So, you've just gotten contact lenses. Nervous about putting them on? Don't be. You'll be amazed how quickly it becomes second nature. Here's a tip. Don't think of it as putting a contact lens in your eye. You're putting it on your eye. You barely touch your eye at all, because the soft lens glides into place as soon as it reaches the surface. And if you're wondering, your lenses can't get lost behind your eyes. They can't get stuck to your eyes, and it's almost impossible for them to fall out on their own. Bottom line, it's easier than you might think. And the more you do it, the easier it gets. Okay, let's get to it. First, always wash and dry your hands before you touch your lenses or your eyes. You definitely don't want dirt or germs on either. Always start with the lens for your right eye, so you don't mix them up, since each eye has its own prescription. Scoop your lens out of the case, then follow the instructions for your lens solution. Making sure your finger's dry, put the lens on the tip and take a close look. If it's shaped like a little bowl with a nice straight edge, you're good. If the edge curves outward, it's inside out. Flip it. Use your lens hand to pull down your lower lid. Using your other hand, hold your upper eyelid. Gently place the lens on your eye. You can put it right on the center of your eye or on the white part just underneath, whichever feels best. When the lens is all the way on your eye, slowly release your upper eyelid and close your eye for a moment. Blink a few times and look around to center the lens. And that's it. One more tip. If you wear makeup, put your contacts on first, so any makeup on your hands doesn't wind up on the lenses. Now do it again with your left eye. Well done. All right, you've had an action-packed day thanks to your new contact lenses. And now, it's time to take them off. Most people think removing contacts is even easier than putting them on. What's the first thing? Right, wash and dry your hands. Prep your lens case with fresh solution. Just like when you put them on, start with your right lens. Look up and pull down your lower eyelid. Bring your index finger close to your eye until you touch the lower edge of the lens. Slide the lens down to the lower right part of your eye. Gently squeeze the lens between your thumb and index finger and remove it. If you're wearing one-day lenses, just toss them out. If you're not, follow your doctor's instructions on how to clean them before putting them in the case. You'll want to replace your contact lens case every 3 months or so. And this is very important. When it's time to switch to a fresh pair of lenses, be sure to stick to the schedule your eye doctor gave you. Over time, the proteins in your tears slowly build up on your contacts. So do dust and pollen. If you wear your lenses longer than you're supposed to, there's no hiding it. Your eyes will look red and tired. They'll be itchy and irritated, and you won't be seeing your best. A fresh lens is a better lens. If you need help keeping track, you can sign up for free reminders from Acuvue. As always, if you have questions or if you just can't get your lenses to feel right, ask your eye doctor. Even if it takes a little practice at first, putting your lenses on will become routine, and you'll be out and about in no time, looking and feeling great.